So when you come on the day with your mum or dad, what we'll do is we'll get you nice and comfortable in the chair, and then we'll start to use this machine which has the happy gas in, like we spoke about. The happy gas, when you're having the treatment, will make you feel a little bit more relaxed and a little bit happier about being here. Your toes will feel slightly tingly in your fingers, and how we have the happy gas is by using this nose piece. So what this nose piece does is we'll pop it on your nose, and the most important thing that you can do for me is make sure that you breathe through your nose and not your mouth. So you need to make sure you don't have a cold or anything before you come. Have a little go with it and pop it on your nose. Perfect. And what will happen is that will feel a little bit tight. It'll feel a little bit tight on your nose when you're using it. Once we're done making sure that's on comfortably, what we'll do is we'll start the dental treatment, and I'll make sure that you're aware of everything that we're going to use. So sometimes we will use the tooth cleaners, which will be, sometimes they're Mr. Fuzzy, which will feel a little bit bumpy to clean the tooth, and sometimes we'll use one with lots and lots of water to clean the tooth. Once everything's sorted, we'll sit you back up. This will still be on, and you'll still be doing a really nice sniffs for me. And then I'll turn that off, we'll take this off, and you should feel absolutely normal to go back to school. Shuffle yourself up so your head's all the way on that pillow. Is that okay?
Yeah. Okay.
Perfect. And then what I'm going to do, you know we had a little look at this earlier, so I'm just going to pop that on your nose, okay? So it will get a little bit tight. I don't want to get your hair on your glasses. So pop your chin up to the sky for me. There we go, there we go. And then it's going to start to get a little bit tight, alright? Just going to wiggle it on. And then you just keep breathing through your nose and keep your lips closed for me. Perfect. Does that feel nice and tight? Good. Perfect. So you're just going to do really nice normal breaths for me, not too deep, not too shallow. I'm going to slide it off. Wiggle it off. So you've done amazingly. So the poorly tooth is now gone. So what we need to do now is make sure that we really, really look after that gap, okay? So what we need to do is, you're allowed to go back to school, but just no running around, no playing games or sports, so just take it chilled when you go back. You need to remember that you'll be a little bit numb and sleepy in that area. Can you feel that it still feels a little bit tingly?
Yeah.
And I promise that will come back. That will come back in 1 to 2 hours. You just need to make sure you don't bite your lip, and make sure that you don't have anything too hot to eat. So you can have something to drink, but maybe try to avoid having something to eat until it feels totally normal again. Okay? The other thing is, you need to make sure you don't pop your tongue or your finger in there, because your finger's not clean, and we want to keep that as clean as possible so it heals really, really nicely. And then I've said to Mummy and Daddy about making sure from tomorrow you can brush your teeth as normal this evening, but from tomorrow I want you to rinse almost like a mouthwash, but just with salty water. And you can do that at a different time to brush them with Mum and Dad. Okay? Do you have any questions? Perfect. You did amazingly.